The House Health Policy Committee will come to order. Would the clerk please take attendance?
Chair Rogers.
Here.
Representatives Witsa.
If you're asking if I'm here, I'm here.
Thank you.
Here.
Thank you.
Carter.
Here.
Hadsma. Neely.
Here.
Glanville.
Present.
Kofia. Conlon.
Here.
I think that was Kofi.
That was Kofi that was here.
Yep.
Thank you. Farhat.
Here.
Fitzgerald.
Here.
Miller.
Here.
Reinkens.
Here.
Vanderwall.
Present.
Filler. Mueller. Van Werkum.
Here.
Roth.
Here.
Schmaltz.
Here.
Thompson.
Here.
Madam Chair, you have 16 members present. You do have a quorum.
Thank you. Representative Fitzgerald moves to approve the minutes from our meeting on June 8th. Seeing no objection, minutes are approved. Today we will be hearing HB 4081 to the we will be referring, HB 4081 to the Behavioral Health Subcommittee for their review, and then we will hear testimony on HB 4608. House Bill 4081 was introduced and referred to the Committee on Health Policy. It is my intention to have Chair Braybeck and the Behavioral Health Subcommittee work on these bills. Madam Clerk, please read it in the provided letter.
The letter dated June 15th, 2023. Dear Madam Clerk, on February 14th, 2023, House Bill 4081 was referred to the House Committee on Health Policy. This bill requires public schools to meet pupil-to-school counselor ratios in order to provide counseling services to Michigan's students. I am asking the Subcommittee on Behavioral Health to review and make recommendations to this bill. Determining the number of school counselors necessary to meet the needs of our students and ensuring that there are adequate resources available to meet those needs is an important goal. I am confident that the subcommittee will be successful and productive. Sincerely, Julie M. Rogers, Chair, House Committee on Health Policy.
Thank you. Proceeding to the main item on the agenda today, we will be taking up HB 4608 in regards to licensing of dietitians. To testify in support of the bill, we have Sarah Henning, Legislative Director for Representative Pohutsky, and we will then hear from Emily Miller, representing the American Nutritionists Association in opposition to the bill. In support of the bill, we will be joined by Mark Theismeyer Hook, registered dietitian and president of the Michigan Academy of Nutrition and Dietetics, and Beth Thayer, registered dietitian. Joining via Zoom will be Charlotte Burrell, senior director of state legislative and government affairs with the Academy of Nutrition and Dietetics, who will be able to answer any technical questions. To provide an overview of the legislation, can we please have Sarah Henning join us to testify to Representative Pohutsky's bill? Welcome and begin when you are ready.
Good morning, everyone. Honorable Chair Rogers, Majority Vice Chair Whitsett, Minority Vice Chair Vanderwall, and distinguished members of the Health Policy Committee. As was stated, my name is Sarah Henning. I am Representative Lori Pohutsky's Legislative Director, who will be testifying on behalf of her legislation HB 4608 today on her behalf. Thank you for having me. I also want to take a moment to acknowledge Senator McDonald for championing this legislation last term and the hard work of our partners at LARA and, of course, all the incredible professionals at the Michigan Academy of Nutrition and Dietetics who have worked for years to put this bill together. I will keep my comments brief to allow for the dietitians to share why this bill is critically important and their expertise in this field. House Bill 4608 provides a pathway to licensure for registered dietitian nutritionists in Michigan to practice medical nutrition therapy. In the bill, the practice of medical nutrition therapy is defined as the provision of nutrition care services for the treatment or management of diseases or medical conditions. This includes ordering laboratory tests to check and track nutrition status, recommending nutrient needs based on dietary data, and working with patients to establish food and nutrition goals. Michigan is one of only 2 states that do not provide licensure for RDNs. With numerous and often changing sources of nutrition advice and opinions purporting to be able to treat a wide variety of ailments, it can be very challenging for individuals with particular diseases or conditions to determine who they can rely on for competent, safe, and appropriate advice. Licensure enables Michigan consumers to easily identify those individuals Michigan recognizes as qualified providers of medical nutrition therapy. In order to be licensed, this bill would require the following: a bachelor's or master's degree from a regionally accredited university, successful completion of a didactic program accredited by the Accreditation Council for Education in Nutrition and Dietetics, an agency recognized by the U.S. Department of Education for accrediting dietetics and nutrition programs. They would also be required to complete 1,000 hours of programmatically accredited supervised practice experience under the supervision of a registered dietitian nutritionist. It would also require successful completion of the registration examination for dietitian nutritionists administered by the Commission on Dietetic Registration. Something else that's important to note is what this legislation does not prohibit. As you can see, starting on page 7, section 18353, subsection 4, there are several practices that this bill does not prohibit. For example, it does not prohibit a physician or other individual licensed under any other part or any other act from performing activities that are considered the practice of medical nutrition therapy if those activities fall under that individual's scope of practice. It does not prohibit an individual from providing evaluation, guidance, information, and education on the use of food, food materials, or dietary supplements. It does not prohibit an individual from providing general, non-medical nutrition information, guidance or encouragement, individualized nutrition recommendations for wellness. And it does not prohibit the provision of non-medical advice and services from personal trainers, health food stores, weight loss programs, and holistic nutritionists. None of these folks are affected by this bill. With that, I would like to thank the committee members for their time today and for your attention.
Thank you. Do we have questions? Representative Reingans. And I would like the record to reflect that Representative Hadsma, Mueller, and Filler are present.
Thank you. Thank you, Madam Chair. Thank you so much for being here today. I really appreciate it. I think that we used to have a licensing requirement in Michigan, but that it went away. Do you know why that happened? Or I don't know if this is for a different person, but do you happen to know?
Yeah, so the folks from the Michigan Academy of Nutrition and Dietetics would have the answer to that question. I'm not aware of the answer right now.
Okay, but we did used to have it.
Yes, we did used to have.
For a long time.
Yes.
Okay, I'll ask again. Thanks.
And do you know, as a follow-up to Rep. Reingans' question, what year, can you talk about the history of when there was licensure and now there's not?
I unfortunately don't know the answer to that. I'm
Okay.
very sorry.
Any other questions? Minority Vice Chair Vanderwall.
Thank you, Madam Chair. Appreciate you being here. Just, real quick question on the training and the hours that are incorporated. Where does that compare to other licensure and the hours recommended? Is this excessive? Is this normal?
So what I can say is that in working on this legislation with Laura and with the Michigan Academy for Nutrition and Dietetics, it was largely modeled after the other 48 states who do have licensure for RDNs, and it was something that Laura agreed to was necessary to fit with the licensure requirements as matched by the state or in other professions. So they agreed with that.
Any other questions? Okay, thank you so much, Sarah. From the American Nutritionists Association, we have Emily Miller testifying in opposition to the bill. Welcome and begin when you are ready.
Thank you. Good morning. My name is Emily Miller. I am a practicing CNS in Michigan, and I'm also representing the ANA here today to discuss this bill. Our main concerns with the bill are the exclusive scope of practice. There was, I believe it's in 2014, in regard to your question, there was a bill, but it was repealed because of the limited scope that it provided. So as a practicing CNS, I have a bachelor's in biomedical science, I have a master's degree in human clinical nutrition, and the CNS requirements, or to become a certified nutrition specialist, require 1,000 hours of supervised experience as well as a master's level sitting exam. As of right now, those requirements are higher than the registered dietitian nutritionist. So based on the bill's language as of right now, if this went into effect, as a practicing CNS, I would not be able to provide medical nutrition therapy to my clients. And I am well experienced to provide that, having my master's degree and going through the requirements as a CNS. With the ANA, I think this is something that we would like to further discuss and try to come to an agreement on in regard to licensing. To go from Michigan as of right now has no requirements to then go into an exclusive scope, it's very limiting to us. And I am a business owner here. I have been living here for 32 years. This would remove almost my entire practice. Because I work with people that have disease conditions. I work with diabetes, thyroid issues, all of those sort of things under my CNS. And I specifically obtained the CNS because I believe in the validity and the knowledge base that it provided to me. Even though Michigan did not have anything at the time that I obtained my CNS, I had the thought and expectation that at some point it likely would. And so I wanted to obtain the highest level of certification and experience and knowledge that I could, and going that path allowed that. So thank you for your time.
Do members have questions for Ms. Miller? Representative Glanville.
Thank you so much for being here today for your testimony. Thank you, Madam Chair. Can you clarify for me, you said that the requirements in the bill are less than the requirements that you went through for your CNS, but and that's where I need some clarification. From what I'm seeing, it's 1,000 hours of oversight and practice that's required in the bill, and you said that's what you have. Is that correct?
Yes, I was speaking more in regard to the education level. As of right now, it's more of a bachelor's degree. I know that from an RDN level, they're discussing implementing a master's level requirement, but that's not until, as far as I know, 2024. So I have a master's level in human clinical nutrition on top of having my 1,000 hours.
Yeah, so help me understand how you would not be qualified. Is there just a different test you have to take, or is there additional, do you need continuing ed credits? What is it that keeps you from practicing under this law?
It would be having a CNS. So I am Emily Miller, CNS. I don't have the RDN. So this bill puts in exclusive scope only for RDN. So because I have the CNS, even though I have a master's degree, even though I have the 1,000 hours just like an RDN, and I sat for an exam, I have the same continuing education requirements in that I have to complete so many within 5 years every year, or every 5 years in order to maintain my CNS credential. It's not the same.
So what would you need to do to become an RDN? What's keeping you from that classification?
I would have to go back and essentially like take their course load in order to complete it. And when I already have 2 bachelor degrees. So when I was initially looking at going through a nutrition route, at the time I didn't want to go back and get a 3rd bachelor's degree. I wanted to go master's route, and the CNS then allowed me to obtain my master's degree and sit for their exam. So it just made the most sense for me, but in order to do it, I would have to go back and obtain my RDN instead, which would be like sitting for their exam on top of potentially doing coursework that might be
Sure. No, yeah, I understand your predicament. I'm a certified teacher, so
Yeah.
I have had to go through many re-educations and certifications to be qualified to do my job. So
Yes.
I hear what you're saying there. So thank you.
Yeah.
Following up on that, can you explain for the members what CNS stands for?
Yes, it is a certified nutrition specialist. It is the highest level that you can, highest level of certification you can obtain. As I stated, in order to sit for it, you have to have a master's degree or higher. You have to have 1,000 hours of supervised experience, and then the exam itself is a master level exam. As far
Thank you.
as I'm-
Thank you.
Okay.
That, you've answered the question. Representative Thompson.
Hi, thank you so much. Thank you, Madam Chair, and thank you for your testimony. My question is, how will this bill affect current nutritionists and dietitians. I am a nurse and I've worked closely with nutritionists and dietitians in long-term care settings, skilled nursing facilities, and hospitals. Is there anything that we would do in order, if we're going to require more of the licensure through Laura, does that allow you to do anything more than you do right now? So, for example, lab work. So, working with a patient that is a diabetic or working with a patient that has multiple skin breakdowns or ulcers, I'm working side by side with the nutritionist on getting lab work to see what their protein levels are and monitor their wound care, or as far as their intake and monitoring their sugar. Is there anything that this bill would do that would allow you to do more than you're doing right now? Or would it hinder you and take a lot of people out of the field right now in a time when we're critically in need of people within the healthcare field?
Thank you for your question. It would fully hinder my practice and anybody that is a practicing nutritionist as of right now, because based on your definition there, it sounds like that would be providing medical nutrition therapy. So the bill does not allow any nutritionist to practice medical nutrition therapy. They would have to have the RDN licensure. So that is our main concern, is that it is exclusive scope and for RDNs, and it doesn't allow for anything else, despite the fact that there are many pathways now to obtain this sort of knowledge and experience level. And what is also concerning to us is that there's no sort of grandparenting noted within the bill. So any practicing nutritionist or CNS as myself, we would not, based on the language of the bill as it stands today, we would not be grandparented in. So I would lose the vast majority of my client base and my practice for that reason, because I do provide medical nutrition therapy.
Thank you.
Representative Conlon.
So, thank you, Madam Chair. Thank you for your testimony. So do we have an idea of how many CNS, what's that population in Michigan? And can you so are you saying that you can currently now do those things that were just outlined by Representative Thompson, like lab work and wound care and all of that those things she's asking about?
Thank you for your question. I do not order lab work, but I can read lab work and work next to and concurrently from a nutrition basis on working with wounds, with diabetes, with all of those sort of things. I just do not directly order the labs, but I do have the ability to read lab work and then provide medical or nutrition advice based on those results. As of right now, as far as I know, there's over 25 of us that are either already have a CNS or in the process of obtaining a CNS. And it sounds small, but what I'd like to know is that as of right now, Michigan had nothing. And so all of us went above and beyond the current requirements to know and call ourselves a nutritionist by obtaining this level of certification. So we've gone above and beyond to do this, and it would just be really disappointing to have that fully removed from us. The time and the effort and the knowledge base that we have been able to accumulate and then help so many people with that. Thank you.
Representative Farhat, and then Schmaltz.
So, thank you for being here and for sharing your testimony with us. I guess my question is, other states have similar licensure standards. And so when comparing what's in front of us here today and comparing what other states have or have put forward, what is it, I guess, that we're doing more or less of, in your opinion, to get kind of a gauge of where we are as a state in this process?
Oh, very good. So as right now, there are several other states that do have licensing requirements, but most of the states provide pathways for CNSs to be considered licensed in that state. So as of right now, what Michigan is doing is very exclusive, and it's set only for a very small group, the RDNs. Whereas other states, they provide pathways for an RDN or a CNS to be considered a licensed nutritionist still. Or what other states are also doing is providing exemptions for an appropriate level of education and experience level, such as a CNS. So we would be considered like exempt from.
One small follow-up. Sorry. And then can you talk about kind of the type of laboratory testing that you said you can order?
I
Or
cannot
you s-
order testing,
yeah.
but if the doctor orders lab work,
Uh-huh.
they can bring that lab work into me and I can read it and
Okay.
interpret it for them, help them understand it, provide nutrition recommendations.
Context and things like. Okay,
Exactly.
okay. I just want to make sure I understand that part correctly.
Yes, no, I don't order lab work.
Okay, yeah, I figured as much, but I just wanted to make sure
Yeah.
for my understanding. I appreciate your context so far. Thank you.
Yes.
Thank you, Chair.
Thank you. Representative Schmaltz.
Thank you, Madam Chair, and thank you for your testimony. You might not be able to answer this, but how do you think this would affect holistic practitioners and those with alternative therapies? And then how do you think we could change this bill so it would be acceptable?
Yes, thank you for the question. As far as I know, it would significantly impact that group of individuals as well, because they would also be providing medical nutrition therapy. It would just be considered alternative or holistic. So based on the current bill language, they would be excluded as far as I know. I think the main concern is that this bill, the ANA was not consulted when this bill was pushed through. And so what we would really like to see is a coordinated effort, again, to try to come to an agreement, similar to what we've done in other states, of potentially creating these two pathways or having an exemption or at least a grandparented information included within the bill to allow people that are currently practicing in Michigan to continue to practice. I think it would be a huge detriment to the Michigan residents as a whole to all of a sudden lose these subsets of individuals that have nutrition knowledge and are well qualified to provide care, but then are being excluded.
And this would give individuals more choices, obviously.
If the bill was amended, yes.
Right, and what's the penalty if you did this without a license?
I do not know, but I imagine it would not be good.
Just, yes, I'll ask that. Thank you.
Thank you so much. We appreciate your testimony. Next up, we have Mark Theismeyer Hook and Beth Thayer with the Michigan Academy of Nutrition and Dietetics, and also joining us via Zoom for legal questions and technical, we have Charlie Burrell. Welcome, and I'm sorry if I mispronounced your names.
Good morning, Chairwoman Rogers and members of the Health Policy Committee. Thank you for speaking with us today. My name is Mark Theismeyer Hook. I am a business owner, a registered dietitian, and president of the Michigan Academy of Nutrition and Dietetics. Beth Thayer, Charlotte Burrell, and I are here to testify in favor of HB 4608, which would license the practice of medical nutrition therapy. I'm going to give you the view from 10,000 feet on this bill, and Beth will later address the history and some of the CNS concerns that you just heard. First, who exactly is a registered dietitian? Registered dietitians complete a programmatically accredited dietetic program at a bachelor's, master's, or doctorate level. They complete a programmatically accredited supervised practice program, rotating through various clinical programs, and they pass a national credentialing exam. RDs are part of the medical team, providing nutrition diagnosis, therapeutic nutrition treatment, and nutrition counseling individualized to the complex needs of each patient. We have over 4,000 RDs in Michigan, with the vast majority working in clinical settings practicing medical nutrition therapy, or M&T. What is M&T? M&T is the provision of nutrition care services to treat or manage a disease state or a medical condition. Now, here's the high-level view of why HB 4608 is so important to Michigan. As you heard, Michigan is one of only 2 states that does not yet license, credential, or otherwise legally recognize the title of dietitians. And this puts our state at a disadvantage. You have in front of you Michigan's health report card as we rank against the other 49 states. There's a lot of information on this report, but I'd like to call your attention to just 2 points. At the top, you see that we get the lowest grade for cardiovascular disease. Strokes and heart attacks are the leading cause of death in Michigan. MNT is research proven to not only be effective at reducing disease risk, but also more effective than other medical treatments. Second, nearly 1 in 8 Michiganders suffer with diabetes. 1 in 3 are pre-diabetic. The American Diabetes Association estimates that those with diagnosed diabetes cost Michigan $9.8 billion each year. Dietitians are the heroes of diabetes management. Patients who work with dietitians often can keep diabetes under control and prevent complications. But the point I really want to make is that MNT conveyed or provided by a dietitian is shown to be cost effective at preventing diabetes in the first place. And licensing MNT in Michigan could save Michigan millions of dollars in the healthcare expenses it's paying right now. Dr. Meleb is a surgeon at the University of Michigan, and when I told him I would be testifying today, he told me why he thinks this bill is so important. Before he can operate on a patient, he needs to make certain that their hemoglobin A1C, which is a measure of diabetes management, is under control. When the number's too high, he refers them to the Michigan's Metabolism and Endocrinology Clinic. One of his patients recently told him that the clinic is backlogged 2 months. They suggested the patient see a dietitian in private practice. Now, unfortunately, that patient's insurance won't cover an RD in private practice because Michigan does not yet license MNT. Dr. Meleb is faced with a dilemma. His patient really needs the surgery, and yet if he does the surgery, that patient is at a twofold risk of infection and rejection of his surgery. They need to manage their diabetes first, and we have an access problem in Michigan. Patients who need our help often cannot see us. MNT is a proven method at improving health and reducing costs. When done correctly, it can decrease hospital stays, keep people out of the hospital, decrease and in some cases eliminate the need for medications and other costly medical treatment. Nutrition care provided before disease occurs can prevent diseases such as heart disease and type 2 diabetes. HB 4608 paves the way for us to start working on improving the health in Michigan. By licensing the practice of MNT, you can improve access for Michigan citizens to receive quality nutrition care. Now, on a final note, in addition to being a dietitian, I own and run a fitness studio. I have personally witnessed the rise in obesity and chronic disease in Michigan, and we need every foot soldier in fitness and in health to be helping. I'm proud to say that HB 4608 was carefully written to not take away people's jobs. My personal trainers, nutritionists, and other wellness practitioners can still help people improve their nutrition, fitness, and health. They can and they should help people lose weight, cook healthier, understand supplements. Our bill solely licensed the practice of MNT, and Beth will explain more in detail. Thank you.
Good morning. My name is Bethany Thayer. I was born and raised here in Michigan and have been practicing as a registered dietitian since 1989. I've been working all that time to improve health through nutrition in the community, in hospitals, and in academia. Currently, my role at Henry Ford Health, is I'm the director of the Center for Health Promotion and Disease Prevention, and I hire dietitians in that role. And at Henry Ford Health, we have about 100 registered dietitians who are providing our patients with clinically indicated medical nutrition therapy. And I do regularly hear stories from them about how some of their patients have had their health set back because they've received information from unqualified practitioners. The legislation that you have in front of you is a revised reintroduction of SB 614. We worked tirelessly, and I'm tirelessly with the American Nutrition Association on drafting a licensure bill for the past 4 years. As such, all those multiple iterations that were drafted did provide a dual pathway to licensure. But last year, Lara shared feedback that they would only support a bill that relied on programmatic accreditation of education and supervised practice. Even with this feedback, we continued to work on drafting a bill that would allow for immediate licensing of other qualified practitioners once programmatic accreditation was achieved. However, Lara's response to that draft was, and I quote, "Rules shall not be promulgated for nutritionists until the establishment of a national accrediting body." Therefore, since the RD credential is the only nutrition credential that requires programmatic accreditation of the academic and supervisory practice requirements, it's the only pathway that the licensure is provided for in this bill. We are proud of the work that's been done on HB 4608, and because we've had several drafts of the bill, I'd like to take a few minutes to address a few concerns that have come up just now and earlier. This bill, number one, is narrowly tailored to the practice of medical nutrition therapy for the treatment and management of individuals' diseases and medical conditions. It does not impact those who are providing basic nutrition services. Secondly, it serves to protect the public from harm by establishing minimum qualifications to reduce confusion and increase consumer information when seeking qualified providers of medical nutrition therapy. Third, it balances the consumer's right to seek information from a variety of sources and their need to know which practitioner meets minimum standards for education and competency and to receive their nutrition care from competent practitioners. Fourth, it does not put anyone out of work. As you just heard from Mark, as personal trainers, coaches, and others can continue to provide information on healthy eating. Organizations like CrossFit have in their own training handbook the statement that states a certified CrossFit trainer recognizes the limitations of his or her own knowledge and skill set and refers clients to other healthcare professionals when appropriate. And finally, it does not impact the sales of supplements. Licensure would also increase patient access to medical nutrition therapy, as insurers are less likely to cover medical costs from unlicensed practitioners. Licensure is not just common, to my knowledge, it's mandatory in all healthcare professions. There'd even be additional conservative savings of $14.5 million per year, according to estimates from the Centers for Medicare and Medicaid Services, as this bill would allow for diet orders for allowing the physician to assign that responsibility to qualified nutrition professionals. So in summary, evidence-based medical nutrition therapy provided by licensed dietitians will help improve quality of life, as well as lower healthcare costs, avoid expensive medications, and increase the productivity of Michigan's workforce. Ensuring that the Michigan's residents have access to competent, qualified medical nutrition therapy to address disease states and medical conditions would best be achieved by passing this legislation. And with that, we urge you to support HB 4608.
Thank you so much for your testimony. I just want to repeat something you said then. Rules, you said that in prior drafts in versions of this bill, Lara had said they would only support such legislation in that rules shall not be promulgated unless there's a national accreditation standard. And so I just want to clarify, we've heard about CNSs versus RDs. CNS does not have a national accreditation?
Correct.
Thank you. And then you said someone had said 48 states, so we would be the 49th.
Yes.
Okay. Representative Filler.
So I guess your argument for someone who said they won't be able to practice is, no, they'll just have to practice differently. They just won't be able to do the same thing that they're doing right now. They'll be able to do some of it, but not the
so
same.
the medical nutrition therapy, so people who have diagnosed conditions was where medical nutrition therapy would fall, which is pretty narrow in terms of the amount of nutrition information and that can be given.
Can you give a couple examples to his point? So diabetes was mentioned, but can you talk about other conditions, like what other medical conditions are examples of something?
Oh gosh, anything like cancer, GI, thyroid, malnutrition. Go ahead.
So one of our dietitians is a critical care dietitian. She has a patient who came in and he was a stuntman who had an accident, and he had to be put into a medically induced coma when he went into sepsis. Now, she was providing his tube feedings and controlling all aspects of his nutrition that helped him to have a success of not losing muscle and being able to recover really well after that happened. That is not, in Michigan, a licensed job. So you can be in a medically induced coma and have somebody who isn't licensed controlling your nutrition, and that's problematic. So this helps to protect, and is just necessary for that.
Thank you. Going back to Rep. Fuller, sorry for interjecting there.
No, I appreciate the clarity. I guess one of my concerns would be, we want more people offering nutrition and diet advice, and this might restrict some individuals for doing that, as we clearly have an issue with diabetes and other things. And so that would be a concern I would like to bring up.
And I gave in my testimony that 1 in 3 Michiganders has prediabetes. There is a huge opportunity at that point to use nutrition and lifestyle to prevent that from going into a full diabetic state. And you'll see on page 8 of our bill that there's a big carve-out in prediabetes for weight loss programs to exist in a non-medical nutrition therapy setting, which would allow people like nutritionists to continue to work with those 3 million Americans if that program has been approved by a licensed professional.
Representative Reingans. I'm sorry, it's been a long week.
Thank you, Chair. So I am, in my mind, trying to figure out the differences between registered dietitians and certified nutrition specialists. And as a person coming from a public health background, I'm hearing the term medical nutrition therapy a lot. So I am going to put my old adjunct professor hat on and just remind folks that there's a medical one-on-one patient treatment that we do. We tailor our treatment to each patient using the medical model one-on-one for their condition. There's also public health interventions we do where sometimes they are delivered one-on-one as part of a public health program, but that program serves many people, trying to get them to a different space as a population, right? So what I'm seeing is there's 2 different professions here that have a different kind of lens. Registered dietitians seem to focus more on that medical patient treatment. CNS seem to focus on delivering more wider consideration of factors that influences somebody's health conditions, like the conditions you're talking about, outside of just nutrition, but definitely focused on nutrition, and delivering kind of educational programming. So I do think it would be helpful to have a license for dietitians. I'm a little worried if it excludes CNS, and wonder if there is any state that licenses CNS is that something that would be at odds with this if it was in a separate bill package or bill in some way. So if this happens, is there a way to do that? Are other states doing that? I'm just curious if you know, and maybe the other person might be able to answer that better.
Yeah, I think there are other states. I think where we ran into again, we worked 4 years with trying to make this work, just as you're trying to make it work in your head. And really the block was Lara and wanting they're wanting a program to be licensed only if they're programmatically accredited. And the CNS pathway is not programmatically
The
accredited.
Education pathway.
And supervised practice. So the whole pathway is not accredited.
Okay, I think I understand the difference. Did you want to?
But if they get national accreditation, then they would have a pathway to getting license, or they could apply for licensure themselves.
If the profession itself had a national accrediting body that then determines the educational standards and supervision standards and continuing education standards. Okay, I think I understand the difference that you're saying in that. Thank you.
Thank you. Minority Vice Chair Vanderwall.
Thank you, Madam Chair. Thank you for being here today. Just a couple pieces that you've worked very hard on this bill. I think the first piece as I read in there, there's a board that's going to come and oversee licensure on this. How many members on that board?
Oh, I don't remember where we landed.
I think it's
We had so many-
9.
was gonna
I think
say, we
it's
had so many
9, but
iterations, I
Nine.
don't remember where we landed.
All right,
on
how-
that.
Charlotte, can you give the answer to that?
14.
9
14?
dietitians, a physician, and a public member.
I see that there's a date in there. It doesn't have length of the term, just an expiration of the term. Is that correct?
14. It looks like 9 dietitian nutritionists, 1 physician licensed under Part 170, and 3 public members. Is that correct?
That sounds right.
14.
Two?
So the question to follow up on there, that we now know there's 14. Who determines sits on that board? What is their term? I mean, once they're on forever. Is that correct? Or
I don't believe that's the intent, but I think we'd have to get back to you on that.
okay,
Can Charlie's got her
Charlotte
hand
looks
up
like she has the
online. and
answer.
Can we go to the Zoom?
So sorry, I was trying to speak, but I think in regards to why that's not addressed here, because I had some of the same questions. But I think that the way Michigan does it is for boards that's addressed in a different section of Michigan law that's relevant to a broader scope of boards. So you don't put all that language in this bill, was my understanding, as far as board terms and what that looks like. I think there's a different section of Michigan law that gets referred to.
all right. We'll work with the bill sponsor on that, because I think we need to determine what the length is, how they get selected on a board. I think is very important also in the term. Another piece that I have is we eliminate some of these other practices because they're no longer licensed. What happens if an individual wants to have that choice to go to somebody that hypnotizes them or uses something else for weight loss or dietary purposes or nutrition? What's going to happen to them if they do that? Is that going to be legal, number one? What's the penalty if it's not legal? Because somebody's going to either leave the state if they've tried to have, because let's face it, you know, we all like to eat, right? And we're probably all not the most well-behaved, even if we're getting counsel.
It's probably time to get up and move.
Yeah, run. I ran this morning, but I guess that's the question that I have, because there are a lot of opportunities out there for people, and they choose that now. They do it to quit smoking. They do it to quit eating. What's going to happen if an individual chooses this to try something else?
Right now, in Michigan, every Michigan citizen has the choice to go and see a complementary and alternative medical practitioner. And I don't foresee that will change, that the choice is still in Michigan's citizens' hands, who they choose for their healthcare needs. However, licensure of registered dietitians gives the citizens of Michigan a piece of information that the person that they are seeing has some qualifications and credentialing. I hope that gets more accurate nutrition information out there, but it's still within somebody's privilege to go to their massage therapist and ask them questions about their medical nutrition therapy. Everyone should be practicing within their scope.
Okay. I will work with the bill sponsor and other folks to get a little more information. One last question, if I may, Madam Chair. Just looking through the internet here, a list of the 48 states, because of searching the internet, I see right now that it says there's only 14 states that have licensure for this. It may be different, and I'll have to investigate that further. But if you could provide the last several states that have come on, so that we could look at some of the rules that they put in place and in some of their bill process, that would be greatly appreciated for me.
Yeah, and actually Charlotte's probably going to answer that one a little bit better than I can, in terms of the most recent states that came on board.
So as far as the licensure across the country varies greatly, and as far as like how they regulate the practice and how they do that, as far as states that most recently have changed their laws, that would be in reference to North Carolina, North Dakota, and Nebraska just passed a bill providing for licensure. But again, like I said, licensure varies across the country. I believe 27 states regulate like the practice on some level, and then there's additional states that regulate the title use of dietitians and nutritionists.
Representative Glanville.
Thank you, Madam Chair, and thank you for being here. I don't want to get us too far in this rabbit hole, but I just want to chase down this idea of education and these two different job titles just for a minute again. And maybe, can you help me understand where the gaps are in education and training? If somebody is already a CNS, what is it that they are missing that excludes them from being an RD? What are the additional skills or training that they would need to complete in order to be an RDN? Aside from like they just have to take this random program, like I'm curious, what are the actual skills that are lacking?
Again, I'm going to defer to Charlotte for some of this. All right, Charlotte, you just want to jump in? Go ahead. Go ahead. Go ahead.
So the difference is in as far as how the requirements for each credential are laid out. So for the registered dietitian, you've heard it said multiple times that it requires programmatic accreditation of the academic and the supervised practice. And programmatic accreditation, if you're familiar with other health professions, that is something that is in place to verify the quality of the academic and the supervised practice, and to ensure that those that complete those programs are competent and able to perform in that profession. So there's other types of accreditation, for example, like the National Commission for Certifying Agencies. That's a broader, what I would refer to more of like a baseline type of accreditation. And that is what the CNS credential has. So it is something that the RD credential also has that type of accreditation, but because it's more of a baseline, they set out 23 standards that are applicable to every credential that they accredit. It's again, more general and across the board as far as making sure that there's certain things in place. You have a governance structure, that you're giving your applicants the right information, that you are ensuring processes are in place. But programmatic accreditation goes above and beyond that to actually look at the quality of the program and the standards and competencies to ensure that those coming out of those programs have the knowledge required to practice in the profession. And so that is what's missing from the CNS credential at this time. I believe they're working on that for the academic piece. I don't know where they're at with that in terms of the supervised practice, but what the affiliate was told was from Laura was until that piece is in place, that was too onerous of an expectation to put on them to have to look under the cover, so to speak, and go through that process that programmatic accreditation provides for. Programmatic accreditation, like I said, sets the standards in place. They review the program, there's on-site visits, there's auditing, all that is ingrained in the process of programmatic accreditation. And so that's really the difference in terms of specifically if you're training. There are also differences in training and expectations, but again, a lot of times it's mainly reflected in that programmatic accreditation, because with programmatic accreditation, there's competency requirements that must be in place and knowledge requirements. And when you don't have that's what's lacking for a credential that doesn't have programmatic accreditation.
All right, thank you.
Representative Farhat and then Conlon.
Thank you, Chair. I suppose, I'm surprised no one's worked in a joke about asking for lunch recommendations from the nutrition experts we have. But I do want to ask, the term programmatically accredited has been used probably more times than any other phrases have been used in this conversation. So walk me through what that means. Just in very simple layman's terms, programmatically accredited means X. What does it mean when you're saying programmatically accredited? Because I feel like this is kind of what you're saying is the biggest difference between the two professions. So what does that mean when you say programmatically accredited?
So that
I think that's what Charlotte was just walking through. But
I understand.
Summarize that,
but if you can give me an example, like in a contextual example.
So like, for example, for the RD credential, we have a separate accrediting body, the Accreditation Council for Education and Nutrition and Dietetics, that sets standards and competencies that all programs must have in place in order to be accredited by them. And so, like there's knowledge and baseline requirements for each of those programs. There's certain, types of instructors in that you have to have available for the program. But like when I, look at it, like it actually has those competency expectations in place for the program. And so the program then does sort of you set up your program. If you want to become accredited, you look at those standards, you do a self-study of your program and say, like, how do we come in line with those standards? How do we meet those standards? And then they do an on-site evaluation of your program to make sure that all those types of things are in place in order for you to become accredited, to receive a decision from them. Then there's monitoring from that program where they can come in and audit your program at any time and make sure that your program is actually doing all the things it needs to do to ensure that those students coming out of that program are qualified and are achieving those competencies. And then there's a reevaluation period. So most health professions, to my knowledge, have this separate programmatic accreditation on top of any other type of accreditation that they might have for their program.
Did that answer your question?
That was, yeah. Again, because it seems like that is the big linchpin here, right? And so I just want to make sure as plainly as possible.
Means that some outside body is checking all the boxes.
Validation, verification, right?
To make sure that people coming out of this program have all of those things. And what's problematic about CNS is if nobody's doing that, people can go through that program and not have all of the things that are necessary to do M&T. Not saying that somebody doesn't, but if nobody is checking the boxes on it, we might be getting practitioners who aren't competent to do the work.
Can you also give us a time frame of how long the average accreditation process takes for your program?
The accreditation process
Yes.
on a new dietetic
Yes.
program?
Yes.
Charlotte, can you speak to that?
I know it's a lengthy process. I don't know off the top of my head.
I mean, it's not like 30 days.
Oh, no.
No, it's not a 30. No.
For lay people, I'm trying to give them an idea.
Yeah, it's
Years.
several years.
Thank you.
Henry Ford Health has a
Thank you.
supervised practice, yes.
Thank you. Representative Conlon and then Thompson.
Hello, thank you, Madam Chair. Thank you for this testimony. I am struck by 4,000 registered dietitians in Michigan being a very big number. And did you say if I wanted to go see a registered dietitian, my insurance would not cover it?
It can be an obstacle. What we've heard or learned from Blue Cross Blue Shield is because medical nutrition therapy is not a licensed practice to be done by registered dietitians, it would not be something that they would cover. Now, we get around it because doctors cover it or hospital systems cover it, but a dietitian who's in private practice right now is having to take cash out of pocket for most of the people that they would see, which means private practice dietitians can't currently provide the overflow for this great demand for medical nutrition therapy in Michigan. So that's where you guys can unlock the door for better access to this kind of care, which could help, people not die of heart attacks and strokes.
And so then these registered dietitians as well, are they in a position, I mean, are we lower than most states in terms of how many are in private practice because we don't have this?
I don't have that number, but as a business owner, I
Yeah.
can say I have been a dietitian for 24 years, and it's not a huge part of the practice that I can do because of this roadblock for customers to have to pay out of pocket to see me. So I've had to pivot my practice to general health, but we're graduating. We have 400 students every year, students in dietetic interns, who are facing the decision: do I go to another state to practice where my opportunities are so much greater, or do I stick it out in Michigan and try to work in a healthcare system
One last question. Would there ever be a situation where a registered dietitian would say, okay, you're doing great. In the future, go see your nutrition, keep in touch with your nutritionist at your health club, or go see a CNS for a bit of extra. Would you ever pull them in to what you would be able to do in terms of you can do medical, nutrition therapy and they can't?
Right. I mean, if it's general nutrition guidance, if it's evaluation of their overall nutrients and making sure that they're getting everything that they need, that is not medical nutrition therapy. And yes, I can see a need, or we need, like I said, all the foot soldiers in health and fitness working on the health of Michigan.
Thank you.
Representative Schmaltz.
Thank you, Chair Rogers, and thank you for your testimony. I'm still confused on the alternative aspect of this. So you say consumers will still have choices, but then you're saying the practitioner who's alternative cannot say certain things because they need a license for that. So I don't understand. And what's the penalty to the practitioner who continues to give this advice? I mean, that's limiting consumers' choices of what they want to do or where they want to go.
So I'm going to give an analogy, okay? I am a exercise physiologist. I am a certified personal trainer. And those are titles that tells a consumer what I am capable of doing. But that doesn't mean that someone has to exercise with me. Anyone could help you with your exercise, but you would know as a consumer that they didn't have a title. They didn't have letters after their name. And that gives you a little bit of warning of what to expect in terms of their abilities. Every practitioner in Michigan has to think, this is my scope of practice, and am I stepping out of my scope of practice, or am I staying within it? So I don't see any choice issues being taken out of the equation with this bill. It's just a title protection.
Okay, so you're saying that there's no penalty for somebody who continues to do this, even though they don't have a license?
Charlotte's got her hand up,
Yeah,
so I'm going to let her
let's let her interject here a minute.
Yeah, no, there's a penalty. Now, I don't know what it is. Generally, it's a misdemeanor, but again, I believe the way Michigan does it is in a separate section where it addresses for all professions, like what penalties may be. It's not addressed here. But if you are practicing medical nutrition therapy without a license and you do not fall within one of the exemptions, then you would be in violation of the Practice Act. That being said, something that I point out, it just from the standpoint of, for a thought, is practice of medicine in Michigan is defined as the diagnosis, treatment, prevention, cure, or relieving of a human disease, ailment, defect, or complaint, or other physical or mental condition. And so at this point, I would say that without any law on the books in Michigan, anyone that's providing medical nutrition therapy, regardless of this law, is technically practicing medicine in Michigan without a license. So not having something on the books, it's not just this law, it's all laws to the extent that you are or not just this law but the practice of medicine itself, without some type of law written on the books in Michigan, for the provision of medical nutrition therapy by anyone, whether it's a naturopath or a nutritionist or dietitian, technically in violation of the law.
Yeah, I appreciate that. I see no problem with a consumer knowing who's licensed and who's not licensed. I think that's great. But I don't think we should be limiting who they can go to get their information. I just think that's a problem. Thank you.
I'm going to just interject as a privilege of chair and throw out the example of hospitals. So we have very medically complex comorbidities on a ventilator, multiple tubes, and so I think the point that they're trying to make is there are differences in the acuity of people, and there's differences in the training of different types of people giving nutrition advice and medical recommendations. So some of the very medically fragile they're talking about are tube feedings, and some of the people are not qualified to give those kinds of tube feeding recommendations with the medical team. So that's just one example, but I want to paint a picture for you all that are not in the medical field of part of what they're trying to address. Representative Thompson, I think you're back on Zoom with us. Go ahead.
Yes, thank you so much. Can you hear me? Thank you, Madam Chair. Can you hear me?
Yes, go ahead.
Yes, actually, that was my question to Mr. Hook. He spoke of a registered dietitian who was taking care of a high acuity patient that was receiving tube feeding administration. So my question, Mr. Hook, is the registered dietitian that was able to implement and transcribe that dosage for that tube feeding, how would this change that registered dietitian who is employed at that hospital or healthcare setting? How would that change the fact that she's able to do that, or he is able to do that now as an employee of the hospital and has the knowledge and background to be able to try transcribe that dosage and monitor that dosage to make sure the patient is getting the nutrition needed because of the acuity of their condition? How does that change their employment and their status right now if they are legally allowed to do it right now in Michigan? What would licensing, how would it change their scope of practice, I guess is the point that I'm trying to get to.
Thank you, Representative, for that question. Beth referenced in her testimony that conservatively speaking, there's a $14.5 million savings to hospitals by enacting this bill. And that savings is in changing a procedure that exists right now, where the dietitian is the expert in what the nutrient requirements are for that patient who's intubated, who's receiving a tube feeding, who's being kept alive by the sustenance that he or she is providing. Right now, that requires a chain of orders going back and forth between the dietitian and the doctor. So a dietitian cannot direct order the nutrients. And in that very study that cited the $14.5 million that are saved by allowing the dietitian to directly order nutrients for that patient, they also cited there's an error rate that happens when the dietitian refers to a doctor who refers back to somebody else to administer it. So there's a safety component that doesn't exist now because there's handoffs within that system. The licensing of M&T is going to allow that dietitian and the hospital representative to direct order for the nutrient requirements and prevent those errors, and thus give the cost savings of $14.5 million to hospitals, which is one of the reasons that hospitals are supporting this.
Anything further, Representative Thompson?
Oh, I'm sorry. I guess I was muted. It's my understanding that the registered dietitian does direct order it right now. She writes the order for it. Is that not correct?
It really, at this point, it depends on the hospital system. So it's because it's not a licensed practice, and so it's not in the scope of practice, the hospital does make a decision. And in some cases, the hospitals have agreed to allow the dietitian to write the order, but not all hospitals.
Okay, thank you.
Representative Glanville.
Thank you, Madam Chair. I'm going to pull us back to this education piece. So it sounds to me like the RDN is a nationally recognized accreditation. Is the CNS a state recognized accreditation, or it's just not accredited at all? Maybe that's a better question for our CNS.
No, again, Charlotte, I'll defer, but yeah, it is national, but it is not the programmatic accreditation as she was discussing, as she was talking about.
So CNS is a nationally recognized accreditation?
Yes.
Okay. All right. Thank you.
Opposite. CNS is not accredited nationally.
No. Yes, it is. The title, yes, the title.
But not the
Not
program.
the program, correct. Sorry,
So,
the title, yes.
Can I get a follow-up question here, and just to clarify for myself? So what I'm starting to hear here is that the RDN is really a role within a hospital or a medical situation, and the CNS is, and I don't know the difference, I'm probably messing this up, but in my mind, like maybe clinical. So I think of myself. I don't have a feeding tube. I don't have a condition of acuity whereby I would need to be under the care, necessarily direct care, necessarily of a licensed practitioner. Or, I don't know the words, I'm sorry, I don't mean to. But I do have conditions where I feel like I need nutritional assistance. So I would still be able to go to the CNN and work with that person, and they would be able to see my medical records and give me advice, or no?
So under this bill, the medical nutrition therapy, it would need to be provided by a licensed practitioner.
Okay.
And if I may, the overall nutrition realm of everything one can do in nutrition is like a pie chart. And M&T is a slice of that pie, a narrow slice, but an important slice that actually might need some consumer protection. There's a lot more that someone could help you with in terms of your nutrition, and the CNS may be fantastic for that role. But if you are the 1 in 8 people with diabetes who are requiring, one of the problems with diabetes is it can progress to kidney damage, and it can progress to neuropathy and macular degeneration. And if you were working with somebody on those disease states, this bill would say, these are the people who should be helping you with that situation.
So in what situation would I be referred to a CNS?
For general supplements, for general eating, for how to implement healthy cooking. Our second page of the bill has all of the exceptions for what is not M&T.
Okay, thank you.
Going back to Representative Filler, and then we'll probably wrap up.
Thanks, Chair. I believe I heard testimony that there's not that many CNSs in the state, maybe 25 or something. Have there been issues with CNS that you've heard about? You know, sometimes we make changes in the legislature because somebody isn't practicing as necessary. But have you heard issues, and this is a reaction, or is this just something that you are working on?
Yeah, no, as I said, I mean, we've been working with the American Nutrition Association and the Certified Nutrition Specialists for a very long time to try to find a pathway in here. And truly, it was Lara that said, you know, without the programmatic accreditation, that they would not support a bill.
Is there some kind of support about maybe grandfathering in the 25 or 30 folks who are already practicing so they don't lose practice, lose access? I would maybe be supportive of something like that.
Yeah, we absolutely discussed that. And again, through, I think it was, now I'm going to repeat, it was either LSB or Lara, somebody said that we can't do a grandfathering in that way.
Okay. Thank you for your testimony.
Thank you so much. I'm going to read in the cards of support. HB 4608 in support of the bill. Michigan State Medical Society, Michigan Health and Hospital Association supports the bill. Michigan Academy. We'll come back to that one. Someone wrote Michigan Academy, Heather Dover. I don't know what the Michigan Academy is of. Supporting the bill, Nutrition Balance LLC. Supporting the bill, EC Nutrition LLC. And supporting the bill, Henry Ford Health. As well as Trinity Health of Michigan. The next meeting of House Health Policy will be June 22nd. We have no members to excuse today. Thank you for all joining us. There being no further business before the committee will stand adjourned.